Hey, good evening, Joel. Welcome to
Hi,
welcome to COVID vaccine facts and fiction, episode 4. Good to see you again. Good to speak with you.
you
Um,
too.
the first topic I want to discuss is a listener question. Someone asked about penicillin. If someone has an allergy to penicillin, can he or she be vaccinated with the Pfizer vaccine against COVID?
Okay, so let's start. I'm not a physician. I cannot give a recommendation, a medical recommendation. You can only do this together with your general practitioner and allergist. What I can tell you are the recommendations that are out there. I can tell you the evidence that's been collected to date, and I can even give you some anecdotal stories, even though we don't like anecdotal stories, but they help. So let's start. I'll put the slide up so that there's a reference for people to look at. Share my screen. Here we go. So let's start with the evidence. So to date, we know that in Israel, 2 million people have gotten the vaccine. The FDA published a few days ago a report of the first 2 million people in the US that got the Pfizer or Moderna the Pfizer vaccine. And the reason I bring this is it's a similar number to what we're talking about in Israel. So they followed the first 1.9 million people that got the Pfizer vaccine. And you can see here, there were 175 case reports of allergic reaction. And 21 of these, I don't see where the number is. So I think 21 or 26 of them had to go for follow-up and medical treatment with no fatalities. So out of 2 million people, there were a total of 175 reactions, of which some were considered serious, 21 or 26 of them. They had treatment for allergy and they went home. I would assume that the numbers in Israel are similar. They are being tracked. People can have allergic reactions. Nobody's saying that you can't. But if we go to the American Association of Allergy and Immunology, and we have a look at the recommendation of the allergist there, the link is here. Anyone can go in and have a look, but have a look at recommendation number 6. People with common allergies to medications, food, inhalants, insects, and latex are probably no more likely than the general public to have a reaction to the specific vaccine. And those patients should be informed of the benefits of the vaccine versus its risk. So what's being done? When you go to get a COVID vaccine in Israel, you're being asked by the nurses if you have any allergies. If they suspect that it's something they need to be worried about, they call in a doctor. This is what happened with my mother, by the way. My mother had a reaction previously to the flu vaccine. Now, the flu vaccine doesn't have the same ingredients as the COVID vaccine, but people are worried, understandably. And they said, we're not going to do that here. You need to go to the hospital and do it under supervision. It took a while to arrange. But on Tuesday, she went to the hospital. She had the injection under supervision. Normally, you told to wait 15 minutes. She was told to wait for 45 minutes. That night, she had a headache. The next day, she had a couple of hives around the site of injection. She's completely fine. No reason not to get the injection. When people do have severe reactions, the debate, I assume, is whether they should get the second injection, and that will be done together with an allergist. But overall, in the millions of people worldwide that have already gotten the mRNA vaccines, there are some cases of allergy. They are treated under supervision and it hasn't caused any fatalities. So if you have an allergic reaction to penicillin, you should tell them. You should maybe be under supervision if required, but the recommendation here clearly says that you don't need to be under supervision. You should speak to your doctor. But it shouldn't be something that would stop you from getting the vaccine.
Okay, so glad to hear that your mother's doing well after the vaccine. It seems that the overall benefit here is definitely outweighing the potential allergic reaction, which can be, rarely as serious, but in any cases can be overcome. Now, right. One question that I have has to do with something that I read on the news about 2-3 weeks ago when they started vaccinating. There was an elderly man in Israel, around 75, that received the vaccination, and a few hours later he had a heart attack and passed away. Question is, should we be worried about vaccinating certain people, people at risk, elderly people, those very people that we want to protect the most, that are most potentially harmed by COVID infection? Are they also at risk of getting the vaccine?
So to date, to the best of my knowledge, there have been 4 cases of fatalities after the vaccine on the same day of getting the vaccine. All of them were people over the age of 75, all of them with complicated medical histories. The man that you mentioned.
That's here in Israel for people?
4 in Israel out of 2 million. 3 of them after the first injection, and there was 1 woman 2 days ago on the day of getting the second immunization. All of them had complicated medical background and history. The first man that passed away, unfortunately, had already had 3 myocardial infarctions, 3 heart attacks, and he died of a heart attack. Now, obviously, there might be a connection. However, elderly people or people in general die. So the way to address this is you should investigate if there's a connection. However, you can look at the numbers of people that die on a daily basis in Israel of that age of a heart attack and start to look to see if there's any increase in those numbers. It is very, very unlikely that they are related. However, having said that, if we were to assume that they are related, which I don't think they are, it comes down to risk benefit. And I've done the math on this following slide. To date, on the right-hand side in Israel, 500,000 people have been infected with corona. Of those, unfortunately, 4,000 died. If you calculate that, that would be, sorry, I even made a mistake. Look at that. That would be 16,000 people per 2 million, if you do the math, which would be 8,000 deaths per million.
Right.
All right. Look at that. I'm even editing it as we're going. So on the left-hand side, let's look at the vaccine. The numbers of people vaccinated to date in Israel are 2 million. There have been 4 deaths. That would be 2 deaths per million. So if there were proof or evidence that those people died as a result of the vaccine, that would mean that the numbers of deaths per million as a result of the vaccine are 2 versus 8,000 from the virus itself.
Mm-hmm.
And that comes down to risk benefit.
I think it's also important to keep in mind that the vaccine has been administered primarily to the elderly now. Now they're starting to immunize teachers. So it's likely.
Actually, they're immunizing. Last week they immunized anyone over the age of 50. From tomorrow, anyone over the age of 45. It's going to go down with time. Within about 3 months, I expect there will be data from both Pfizer and Moderna where they're studying what happens in 12 to 16-year-olds, assuming that they get similar rates of efficacy of what they showed in adults. It'll get approval for over 12, so we can start immunizing people over the age of 12 after approval and not before. So the number of eligible people in Israel that can get it will go up. And assuming that the majority of people get the vaccine, we'll get to the numbers that you've seen in the newspapers and on the news about, I think they said 7 million, 6 or 7 million people.
Mm-hmm. Okay, good. So thanks for this slide about risk benefit. I think it's pretty convincing. These stories unfortunately have a tendency to circulate like wildfire. So
I actually want to address that. I think they should circulate on wildfire. I think the Ministry of Health has been extremely open and shared a lot of the data. And that's also very important. Nobody wants to hide anything. Everything needs to be investigated. Nobody's hiding the cases. All of the cases of people that died have been shared and told, and it's on the news. And I think that's important. Transparency is incredibly important. We need to keep it like that.
Okay, good. One last point has to do with something that we touched on in the previous episode about why should I vaccinate if I'm, let's say, healthy, young, not at such high risk? Why is it important that everyone vaccinate, that even people that are healthy that could say, if I do get COVID-19, chances are it will be mild, very little chance of dying in my age bracket, in my health bracket. Why should I vaccinate? And I want to address that once again, if you can.
So I think there's a couple of points we need to address. So first of all, it's true that the majority of the cases have been in the elderly, but we are seeing many, many cases in children and in young adults, and they might have mild symptoms or they might be asymptomatic. But there are now many cases being described in the literature of long-term effects of the virus, and it's even got a name. It's called long COVID. These people are suffering for months and months with symptoms. It could be milder symptoms of loss of taste or smell, which is not something so mild, by the way, for many months not to have taste or smell. It can be problems with breathing. It can be problems with tiredness, fatigue for many, many months. The long COVID is a result of the immune response to the vaccine. It's a result of complications from the virus, not from the vaccine. So long COVID is something that's coming out more and more, and it's happening in younger people, not necessarily in the older people, because the older people are the ones who are getting more severe disease. And the long COVID is happening in people that had asymptomatic or mild disease. Mm-hmm. That's point one. Point number two, I'm using this example from the UK at the time in July and August when they had many cases. They said, don't kill granny. What do they mean, don't kill granny? You have a social responsibility not only to your grandparents, but to the grandparents and people that are at risk, patients from cancer who are having chemotherapy, who can get severe COVID. You need, in this particular case, they were saying, keep your distance, wash your hands, wear your masks, keep the rules. That same thing can happen if we vaccinate. If you vaccinate the majority of people who are young and healthy, you're protecting the older people who are also going to get vaccinated, but many of them might not be able to. Many of the sick people might not be able to. And the whole point of a mass vaccination program is to get to something that's called community or herd immunity. And what do I mean by that? This is a cartoon that I managed to find to try and explain it. So herd immunity is essentially reaching a critical mass, a number, where the people are protected from the vaccine to the point that the vaccine can't jump around. It can't do anything. It hits a wall. And in order to get to that critical mass, you've got an example here on the left. So on the left, you've got nobody's vaccinated, and you can get, in theory, 100% of infection across everybody. And then you could have 40% immunity, and it would still be enough for the red dots of people that are infected to allow spread, because you've got people that are close enough together. But if you get up to 80% of immunity, everybody is blue, or a lot of people are blue, and the virus in red, the person infected, hasn't got anywhere to jump the virus around. So the more people that vaccinate, the chances are we're going to get there. And I do want to address the point that we raised the last time, and we've seen many questions coming in related to the evidence right now in the phase 3 studies of transmission of the virus. What do we know? We know that the virus gave 95% protection, and I really don't like using that term, the 95%, because it's confusing, but we discussed it in the last episode with the numbers. It showed in the clinical studies that the number of people that got the vaccine and were infected was very, very low, whereas those numbers were much higher in the non-vaccinated group, in the placebo group. And when you did the math, you got to the 95%. That was how the study was designed and what it was supposed to show. It was never designed to track and show if you were protected because of the vaccine. It never was designed to show if you could still be infected. If you were infected, you probably would be asymptomatic. And we now know that asymptomatic transmission is close to 60% of all the cases. So somebody could not have any symptoms, wouldn't know they've got COVID, and they'll transmit it. What I said was that we don't have the data yet. It wasn't studied. It's being studied now. it is probable and very likely that the vaccine will protect from transmission, because you'll have enough people that are immune with no symptoms, and it'll be reach a point that will be able to show that. But we just don't know yet. And because we don't know, if you're vaccinated, continue to keep the rules. Wear the mask, social distancing, wash your hands. Eventually, we'll know. This is not a long-term thing. This is something that we're learning along the way. And therefore, if somebody were to argue, what's the point of getting the vaccine if I have to still do all the social distancing, etc., and there's still lockdown, that means the vaccine's not working. That's not true. We're studying it, not we. The authorities, the companies are studying it, gathering the data. These are long-term post-approval studies. It's going to take a couple of months, and we'll have the data, and then we'll know. There's already hints. Clalit last week published a study. It's very preliminary. I wouldn't make any conclusions, but they showed that even after the first injection, after following 14 days from the first injection, their data showed a 33% reduction in transmission, in infection rates. That's the beginning. That's what we're looking for. So let's be patient. Let's wait.
So you're saying that enough people will get the vaccine here in Israel, and that will reduce transmission, and that will look like the picture here on the right side of the slide.
Right.
The blue.
You want to get to the picture on the right. I don't know. Here it says 80%, but this is just an example. The numbers that have been modeled and thrown out for COVID are anywhere from 60 to 80%. So let's take the average. Let's say it's 70%. We know that children at the moment under 16 are not getting it, and that's around a third of the population. So if most people over the age of 16 go and get the vaccination, and we see lines and lines of people waiting to get vaccinated, so I hope we're going to get there, we're going to reach close to 70%. And as I said, probably 3 months' time, we'll have data from the 12 to 16-year-olds, and then you can open it up to over 12. I assume in the future they'll study children under the age of 12. We will learn more and more as we go. One of the questions, and it wasn't on our list, but I'll just discuss it very briefly, the mutations. The British mutation and the South African mutation, Pfizer last Friday already published that the vaccines, the antibodies induced by the vaccines are protective against those strains. So people are worried, and rightfully so. Vaccines mutate. It's related to the rate of mutation. How quickly can
viruses mutate.
Viruses, not vaccines. Viruses mutate. Viruses mutate. Flu mutates very, very quickly, and we need a vaccine every year. We have seen mutations in COVID, and these strains are coming out with the mutations that might be more infectious, but to date, the vaccines from Pfizer seem to be protective. The Pfizer and Moderna are essentially identical in terms of the spike protein. So I assume that the Moderna is also protective. So the mutations are not necessarily something that people should be panicking about. Rather something that we need data and time to understand the rate of mutation in the virus, and whether it is something that would render the vaccine, the current vaccine, ineffective. But we don't know that.
Okay, good. So thanks a lot for addressing these questions. These are important questions. And just a shout out to the listeners. If you guys have any questions, feel free to post on our YouTube, or if you see this on Facebook, we'll be posting this on Facebook as well. And thanks for listening, and hopefully we'll see you soon.
Thanks
a lot, Joel.